Okay, so we'd like to have our final panel discussion. So if we can have Millie, as well as Dr. Mary Elliott and Dr. Snow, as well as Dr. Ringash, please. Are there any online questions? Yeah.
So one of the questions just asked, can you please talk about the pros and cons of iron injections compared to oral supplements for iron deficiency? And is it okay to get them at the doctor's office, similar to B12 injections, or should it be done in a hospital setting? She's just concerned about anaphylactic shock.
I can take that one. So after you've had your stomach out, there's going to be a lot less acidity in your digestive system, and that's very important for us to absorb iron. And so it's not something that our body easily absorbs anyway. So that's different than B12 because B12 has to be joined to something called intrinsic factor, which is only made in the stomach. So after a gastrectomy, it's harder to absorb iron, but it's almost impossible to absorb the B12. After your gastrectomy, you may have enough B12 in your system that will last you even for a year or 2 years. We have a lot of stores, especially if you had good nutrition beforehand. But we do have to follow those patients, and then when they do become B12 deficient, they have to get the injectables. That is very safe to do in a family doctor's office. You're not going to have an allergic reaction to that. In terms of the iron supplementation, patients who have had a history of stomach cancer can certainly take oral supplements, but it's often not going to be enough. And it's IV iron where you're going to find a much higher rate of having an allergic reaction. And it's truly IV. It's not just a little needle the way that vitamin B12 is. So that can't be given in a family doctor's office. And there are newer formulations coming out that need to be given less frequently, which is awesome, lower rates of allergic reactions, but that is something that has to be given. And often if you've been already discharged from an oncology practice, it could go through a hematologist, for instance, or a medical day unit.
And then another question just asks, should patients who had surgery with early gastric cancer, apologize if I butcher this, T1B, be referred to a medical oncologist for chemo and radiation?
I think it's always good for patients to get multidisciplinary advice and opinions because if a cancer is very early, then they may not need anything other than just the operation. But there are a lot of subtleties to these stages, and there are a lot of subtleties to the patients. And I think that coming into a multidisciplinary cancer center, seeing the radiation doctor, seeing the chemotherapy doctor, there's an opportunity then for there to be a group discussion where everyone on the team presents the case, discusses the patient's case, and we can address some of those subtleties of their particular stage and their particular situation. So I actually think stomach cancer is rare enough in Canada that most stomach cancer patients should be seen by all members of the team.
I fully agree. My favorite consult is the one where I get to say, I don't need to treat you.
There was one previous question. I think this one is for Dr. Mary Elliott. And I think I know the answer to this one. I think it starts with M and rhymes with mindfulness. But a lot of our patients, they're fortunate enough to be survivors over many years. And every time a scan comes up, they get something that they call scanxiety. Mm-hmm. So what is the solution to scanxiety?
Well, it starts with M and ends with mindfulness. So we do find that there's a short technique, and there's some beautiful free guidances online for this. It's called the 3-minute breathing space, and it's a portable mindfulness practice. It's called 3-minute breathing space, but you can do it in 1 minute, or you can keep doing them all the way through a scan. And typically, I can't tell you how many people tell me that helps them get through their scans. So that's one technique that people use. I think using mindfulness in advance of scans. So we were just talking about this in group yesterday. The topic was fear of recurrence, fear of progression, that came up in one of the discussions. And talking about how a normal ache and pain is interpreted, if it's a month before the scan, as just a normal, oh, I exercised too much. A week before the scan, it's like, I'm wondering about this. A couple of days before the scan, any kind of ache or pain suddenly becomes disseminated cancer. So I would suggest, using some of these techniques, and especially the 3-minute breathing space is really the backbone of the course.
It's my go-to.
Yeah.
All the time.
Yeah. I used it actually because I'm on call today and there was a situation happening and I wasn't planning that this was going to be running late, and so kind of trying to juggle. So I apologize if I looked rude and was using my phone, but trying to juggle a situation, and then I'm just like, okay, so why don't you notice your experience, gather your attention to the breath, and then expand the breath out into the body. And so I did that sitting here. There we go. It's that easy.
There's a few questions in the audience.
My question is for anyone on the panel. I had my surgery in 2016, and I've been cancer-free. I went through treatments, both chemo and radiation. And although I'm cancer-free, my side effects and symptoms have lasted much, much longer than my cancer. And since I no longer have cancer, I've basically been relegated to my GP and any specialist she refers me to, who then get upset with me because they feel they do not have the wherewithal for someone with my cancer history to understand my symptoms, to possibly know what is wrong and what would be the answer to help me. Does anybody feel that there's a need for a transitional team, somewhere between maybe your oncology team and being thrown into your GP, because you are going to have side effects and symptoms, it seems from talking to everybody in this group, for many, many years to come. And I feel that after our treatment, we're kind of left hanging with a lot of questions, without a lot of resolutions, and without a clear way of where to go for our answers.
Can I start? I'm sure there'll be a number of people who can comment to that, but thank you so much for raising that. I think that's such an important point, and I hope that other people in the audience who may be feeling the same way can also hear what we have to say. I mean, I think part of what you're referring to is the experience of cancer survivorship. Not everyone loves the word survivor, but that seems to be the one we've got at the moment. So the fact that you've been through cancer, but you still have these issues and concerns that haven't gone away and maybe never will go away. I think there's a number of different ways to handle that. There are some cancer centers that do have transitional sort of clinics, like you described. They have survivorship clinics where people will get transferred from their oncologist to these ongoing clinics before they go to the GP. There are other places like the Princess Margaret, where I work, where we think of things as happening more in parallel. So, for example, I see my patients for at least 10 years after their diagnosis, longer if they want to stay with me. But we have a survivorship program that runs in parallel where we can refer people to deal with specific issues. If they have ongoing fatigue, there are programs for that. If there are emotional issues, there are programs for that. So we try to kind of keep things going in parallel. Now, depending on where you are, and especially if you're in a more remote area, you don't have a cancer center near to you, then there's going to be fewer resources. But I would encourage you to look for the word cancer survivor or survivorship. Google it in your local area. You may find that there are programs offered by community centers. There may be programs offered by groups like Wellspring or Gildas Club, which is what we have here, that provide cancer support services. Or you may even find clinics or programs based in some of the hospitals. But reach out to your fellow survivors, reach out to clinicians in the community that are offering those kind of services, because what you're experiencing is very normal, and it's part of this idea of new normal, that things don't completely go back to the way they were before. And it's, if your doctors have checked you and you're more than 2 years and there's no sign of the cancer, of course you're going to have the fear, but it's probably not the cancer. It is all of the effects of all the things we've done to your body over the years and your soul.
One thing I want to add to that, a lot of the patients that I treat do live in rural areas, and it's just not feasible to ask them to drive 8 hours to come and see me. They don't want to do that. So one of the things I do is, when we're all done treatment, I have just one full clinic session on discharge. And we talk about things related to nutrition, things to expect. And I have a very specific part that I put in my dictation. Actually, I have it typed out and I read it. For the family doctors who are in many cases taking over, I give them very specific instructions from a dietary perspective, those types of things. Really important red flag symptoms to look out for. Other symptoms, if they come and they don't resolve, in a week or two, or have an alternative explanation, then they need to be investigated. And I always make it clear, if there are any questions or concerns, even though this patient is discharged, please call me. Please let us know. And we really need to support our primary care providers, because they have to know so many different things. And so just for them to know that they can call and say, should I get a CAT scan now? Should I not? That's very helpful.
Yeah, I would echo those comments, and I would also say that more and more rehabilitation is being built into cancer programs, and elements of them are now being offered online through distant measures. So there's also those possibilities too so our program got renamed the Cancer Rehabilitation and Survivorship Program, the part that looks at those sorts of issues, but they do offer it in parallel with treatment and beyond treatment. Yeah. And just one other thing, it is really important to go, as Dr. Snow was saying, item by item, because there is, the side effects may not go away. There are supportive care means to address each and every symptom, whether it's psychosocial, spiritual, existential, physical, nutritional. So just working through that. It's great Dr. Snow provides that information for family doctors, but the family doctor can address it item by item as well.
So this will be the last question. We will take it, and then we're just going to do our thank yous. So,
what's a pouch? They created a pouch for my intestine, and Katie and I were in Edmonton, and Katie witnessed where I finally got the opportunity to ask the $1 million question, right, Katie? And my last name is McConnell, and the one who spoke was a gastroenterologist with the same last name out of Vancouver, ironic enough. She said they don't tend to do it because it tends to leak. So I stood up in front of all these specialists and said, so what's the alternative? I said, I got people that are dying because the food is going right from here right into the stomach. And now they're complaining that they never even knew about the option. So I think that's my voice. I think me to get more, and Daniel, the last picture on the slide, he's doing the same thing. So it's just made from the intestine, and I think that's why it's working, because it's still part of my system.
So they left you a pocket for food.
Yep, they just create a little pouch, and it works exactly like the stomach.
Maybe we could ask Dr. Coburn to comment.
Yeah.
She knows
Coburn,
more
please
than
come
anybody
join our
sitting up
panel.
here.
Dr. Coburn is a surgical oncologist at Sunnybrook Hospital.
It's an extra area. So if you have a total gastrectomy, if I describe it to the patients, the food goes down your esophagus and then it goes down into the small bowel, which is basically a tube to a tube. And so you make basically a little W or a U and create a bit of a new stomach. The data behind it is not randomized, so there's case series. There's actually a really nice study that came out. I just sent it to you guys. It came out in Annals of Surgery, and it does show that patients do better with that. It is finicky, though. So there's a more of a chance of bleeding. There is more of a chance of leak. It's a longer operation, so there's pros and cons to doing it, but I think it's something that's reasonable for everyone to have a discussion. But the strength of the data is not there, but some people it works well. I don't know, Carol, if you... I did some when I first started. I wasn't really sure that I saw a huge benefit or a huge difference. I think if I had someone who was struggling with weight before the surgery, it's certainly something I would consider for them. But I'm not sure that I've seen a huge difference, but the recent Annals of Surgery paper does show more of a difference than the previous publications. So
Just before I came out, I did go back to Dr. Prest's office. I couldn't meet with her personally, but the receptionist told me that they're doing it a lot more and there's more people alive with it now. That was just before I came here. And that was Surrey, British Columbia. So it might be...
There's certainly surgeons who are huge proponents of it. There are others who don't think it makes a difference, and then most everybody else is kind of in the middle. So, hard to say.
Thank you.
Thank you.
Thank you. So, thank you to the panelists. We just have, so this is the end of the conference. We both really want to thank everyone. I can't believe you guys stayed the entire time. We are about, I think about 40 minutes over schedule, but
I think it's a credit to how hungry you guys are for knowledge and how amazing our healthcare professionals are for being here and sharing that knowledge with you guys. So thank you so much.
So we, again, yes,
Sorry.
Absolutely. We also wanted, again, to thank our title sponsor, Lilly, our other sponsors, our hosting sponsor, Mount Sinai, and Dr. Brar, who was supposed to be part of our panel, but had an emergency today, so I just wanted to say thank you, because actually none of this would have happened without your connection and Melissa and Dr. Swallow kind of coming together and letting us have this space, so we're really grateful for that. Also to Taiho, our gold sponsor, St. Michael's, our silver sponsor, who continues to sponsor us for all our support groups, our partner No Stomach for Cancer, and our bronze sponsor, the Mortgage Center, iDirect Mortgages. Couple of little things. We do have some of our branded material out there. We also have an amazing book written by one of our survivors. She's also an 18-year survivor, and it's called DNA Moments. Proceeds from the sale of this book will go to My Gut Feeling as well. It's also available on Amazon, but if you get it here, the proceeds come to My Gut Feeling, which we would greatly appreciate. We, as everyone knows, it's a volunteer-based organization, and we can't do this without the support of people, donations, sponsors, all of you. We are incredibly, incredibly grateful to be here and to be able to help and to be able to share the information that we have and just our personal experiences. So now to a more fun part. And if I could get the camera to go towards that sign that's right in the corner.
Power of Periwinkle.
Great. So, did everyone get a little gift? Okay, so if everyone could stand up, and as you know, across the country today, we are lighting up, and let's say it together, Katie, Vancouver, Victoria, Lethbridge, Calgary, Toronto, Niagara Falls, Buffalo, New York, Montreal, and Halifax. Cities and landmarks are lighting up in periwinkle blue to raise awareness for a cancer that has next to none. And we are so excited about that. And we're going to be walking over to Nathan Phillips Square so anyone can join us, and we're going to show the power of periwinkle. So what I want you guys to do is crack it open and shake it. And mine doesn't work.
And mine doesn't work.
So I hope yours does.
Another one.
But anyway, so please do join us. Oh, we have a couple. Thank God that we're the last one. So this, and if the cameras could pan and show, this is the power of periwinkle. We are here, we honor those that aren't, and we are here to help those that are. So with that, we have one last little thing, and because this is, again, Stomach Cancer Awareness Day. So, Stomach Cancer Awareness Day, that's an initiative that Katie and I started as My Gut Feeling 2 years ago. It started off with people just taking pictures, and look where we are today. So, our feeling was, where there is light, there is hope. And as of today, a star name has been registered as My Gut Feeling Stomach Cancer Star. Registered today, November 30th, 2018, to mark Stomach Cancer Awareness Day for everyone, everywhere.